Dr. Grabowski, I do want to say thank you for your making suggestions of how to improve the situation going forward. Those will be taken into consideration for our report, along with other opinions as well. I will say one thing about you made it sound like mandatory boosting, when I think that getting a booster should be based on the personal health. Let me give you an example. I was vaccinated, Pfizer, both doses. Later got COVID. I didn't know till I couldn't smell garlic salt, right? I was told I needed a booster to go to Germany. I couldn't get my T cells checked, but I got my antibodies checked. Strong number was 40. Mine was 821. We do run the risk of hyperimmune responses. So I think we have to inject personal medicine into each person as we decide whether it should be boosted or not. That's just another medical opinion, but certainly one that we can discuss further. But I just thought I would say that as I heard you say that, and I appreciate suggestions being made. But Dr. Grabowski, was it known that COVID-19 was particularly dangerous to the elderly by March of 2020?
Yes, the first major outbreak was in Kirkland, Washington nursing home facility, so we immediately recognized how dangerous this could be for older adults.
Well, you answered my next question with the first outbreak. Should that have informed decisions regarding protecting nursing homes?
Absolutely.
Yeah. But a few states, particularly New York, New Jersey, Pennsylvania, ignored this early evidence and directed nursing homes to admit potentially COVID-positive patients, regardless of the home's ability to treat its patient. We heard that from Mr. Hammond as well today. As a physician, this is contrary to what we are taught. And so why is it a bad idea to intentionally introduce an infectious agent into a vulnerable population?
So nursing homes with older adults, frail, living in close quarters, if COVID starts in a nursing home, it's going to spread, and it's very hard to contain once you have an outbreak within a facility. And we saw that in Massachusetts, where I live, New York, all over the country.
As someone who treated a lot of infections, I was always grateful when we were able to do, for example, home IV therapy for infections, because it kept people away from a vulnerable population. Mr. Hammond, did Governor Cuomo say these were necessary to prevent overcrowding at hospitals?
I mean, eventually he said that. It wasn't. It wasn't discussed at one of his briefings at the time. It wasn't announced in any way. The nursing homes didn't know it was coming until they received the memo.
And was Governor Cuomo given alternatives?
Well, they had he himself had put a lot of effort into building alternative overflow facilities. He received help from the federal government in building the facility at the Javits Center, and the Navy ship was also brought in.
So in your opinion, were those facilities used to the extent that they could have been, based on what you were able to investigate and see?
No, I mean those facilities were used very little at all during the worst of the crisis. I think it turned out that it was harder than officials realized to transfer patients. Once the facility was available, you still have to figure out who should be transferred and how they should be transferred. For example, the Navy ship, when it first arrived, it said we can't take any COVID patients. That's a huge obstacle in the situation that was presented. So they eventually got that changed, but even then you had logistical obstacles to moving patients. Those are the kind of things, those logistical obstacles are the kind of things we need to be thinking through now before we're in this similar situation.
Yeah, I would agree. You're either taking all COVID patients or you're taking no COVID patients and allowing more room in the hospitals for non-COVID patients, or for COVID patients. The Comfort only treated 182 patients, and the Javits only treated 1,095. Vice Admiral Mike Dumont pleaded with the Cuomo administration to send patients. This was the Comfort's mission, to alleviate concerns related to overcrowding hospitals one way or another. Nonetheless, the Cuomo administration failed to utilize this support. Ms. Dean, do you think politics was responsible for these federal resources being wasted?
Governor Cuomo liked to blame politics at every turn, that was the reason why people were talking about nursing homes, asking him the questions all the time. He had the resources and he failed to use them. And I think if we uncover where that March 25th order came from, who wrote it, I have my suspicions. I think it has to do with hospital lobbyists. I think there's a money trail. Why were nursing homes the only option? So even though Governor Cuomo likes to blame politics and Fox News and the weather and Mother Nature, he never self-reflected, and that's something that he should have done.
You've been a fierce advocate, obviously, since the beginning on this issue. How has your Governor Cuomo, treated you?
Governor Cuomo, attacks, belittlement. I believe one of his aides said, well, Janice Dean, she's not a reliable source on anything except the weather. Even though I had 2 close family members die in separate elder care facilities, I'm aware of, I haven't seen them, of texts that were exchanged between Andrew Cuomo's brother and the administration calling me interesting names that I don't want to repeat today. But there was no sympathy. There was never a gesture of a phone call, no condolence cards. I don't think he really met with any families. He just decided to write a book talking about how great a leader he was.
Ms. Zayas?
Initially, we actually tried to reach out to Governor Cuomo, and in his press conferences, interestingly, he kept saying that we were being political. And I think, as Janice Dean said, there were seniors and residents who died who were of every political affiliation. And when you're grieving, you're not thinking of politics. You're thinking of answers. You're thinking of getting down to the bottom of why this happened. 1, so that we can have justice, and 2, so it doesn't happen again. So we were saddened when he continued to the end to make it a political issue. And in the beginning, when we're crying and baffled at the order and wondering, like many families did not know that while we were locked on the outside, there was COVID positive patients bringing back through the back door. And only after our belongings of our loved ones were handed to us either in trash bags or in boxes with our parents' name, and our questions started to bubble, that's when we realized, sadly, that this terrible thing was happening. And it just compounded the pain. It's unbelievable how raw the pain is even today.
Dr. Grabowski, going forward to the next pandemic, as you look back, were these orders a mistake?
Yeah, I said it at the time, and I said it in my testimony. This was a mistake.
Ms. Dean?
One of the biggest mistakes this country has ever done.
Ms. Zayas?
Seniors are in vulnerable positions every single day. This is not just a one-time issue. Unfortunately, in the path that we have, both Ms. Dean and I, we have realized that there's horror stories of all sorts, not just during a pandemic, but that the pandemic actually opened up a door to really find out what is going on in these facilities. These facilities do not have proper PPEs or equipment or your training every day of the year. It is just compounded when you're putting an exorbitant amount of sick people in these facilities, and then they're not being separated. Even the staff is working with COVID. And on the eve of my mother, the last I heard her voice, which she sounded like a gargoyle, I was told she was going home. They were going to send my mother with an oxygen tank with a contagious disease without telling me. And when we found out that she was going home and she couldn't even answer the phone when I was calling her she was excited to go home. And when I called her, she didn't answer. I became so worried. And what they were telling me, we're going to send her home with an oxygen tank. And I said, how? If she can't breathe, how? And we had no testing. We had no idea she had COVID. We thought she had a bad cold. And they said, we're just going to send her home. They kept playing games. They supposedly offered her an iPad to talk to me. And I was so frightened at what I was going to see. If my mother had been sent home with an ambulance service directly to her apartment with an oxygen tank, my mother would have died alone because I had no idea what was going on.
Thank you very much. I would say that from the very beginning for this subcommittee, and this is a new subcommittee, this is an after-action review for lessons to be learned and to have a better path forward so that we are prepared, so that maybe we can predict and protect ourselves and maybe even prevent a pandemic. So I appreciate all of you being here today for just that.